Hello, welcome to another video of Tibia. Today I'll be talking about the parts of tibia. Tibia is left in my hand and it is left tibia. Tibia has the upper end, which is this, and this is the lower end. Intervening part in between the end is called the shaft. Let us discuss first the upper end. Upper end consists of the first articulating surface and the non-articulating part. Talking about the articulating surface, view from superiorly, these are the two articulating surfaces. Are the parts of these two larger parts are called condyles. This is the medial condyle and this is the lateral condyle. The articulating surface of these two condyles gives the articulating surface for the lower end of the femur forming the knee joint, and also it gives the attachment on each of the condyles by a meniscus, lateral meniscus and medial meniscus. The intervening part in between the condyles is called intercondylar area. This intercondylar area are projected on the margin of medial articular surface and lateral margin of lateral condyle surface. The projection or tubercle in between the margin is called intercondylar tubercle. Medial epicondyle has on its margin anterior surface, medial surface and posterior surface. Similarly, the lateral condyle on its margin consists of anterior surface, lateral surface and posterior surface. On anteriorly, these two condyles merges to form a large prominent structure called tibial tuberosity, and hence the upper end forms tibial tuberosity in front, two condyles on the posteriorly of the lateral condyle. There is again one more articulating surface is called facet for fibula. This facet for fibula is present posterior lateral aspect of lateral epicondyle, which the articulating surface is on anatomical position, faces backward laterally. Now talking about the shaft. Shaft has three borders. The front is called anterior border, which begins superiorly from the tibial tuberosity, continues downwards. In the lower part, it forms the anterior margin of medial malleolus. This is the lateral aspect forming the lateral border, also called interosseous border, which begins from the articular facet for the fibula. The interosseous border inferiorly it forms the triangular area for the fibular notch on the lower end, whereas the posterior border, which is here, which begins superiorly from the posterior medial aspect of medial condyle, it turns downwards. On the lower end, it forms the posterior margin of medial malleolus. Now, These three borders separate the different surfaces. In between the anterior border and the posterior border is called anterior surface. Anterior surface is palpable throughout its extent on the body. Lateral border lies in between the anterior border and the interosseous border, whereas posteriorly it lies the posterior border in between the interosseous border laterally and the posterior border posteriorly on medial. This is the posterior surface. Posterior surface on its upper end, it shows an oblique line which passes backward and medially is called soleal line, which is here, and the mid of soleal line there is ill-defined vertical slit which dividing the posterior surface into lateral part and the medial part. Now talking about the lower end has medially a projection is called medial malleolus. Medial malleolus is prominent and palpable in the medial aspect of the angle in the living body. Laterally, it shows a triangular area is called fibular notch, and this fibular notch is the articulating of lower end of the fibula and lower end of the tibia, which is here. From the inferiorly it shows a view which is the articulating surface which articulates with the articular surface of talus. Hope from this video it is helpful for to identify the different parts of tibia. If you have any suggestion or discussion or question regarding the parts of the tibia, you can have comment on below. Thank you for this video. See you in the next video of attachment of tibia. Till then, goodbye and take care.